When a patient comes in with chest pain, usually the first test that is done, whether it be the doctor's office or the hospital, is an EKG. The long word for this is electrocardiogram. This is a tracing of your heart's electrical activity, and it can usually tell if you are having a problem with your heart, such as a heart attack. Another test that we do is a set of cardiac enzymes. These are molecules that are released into your body from your heart when there's heart muscle damage. The most common cardiac enzyme checked is the troponin. If the troponin is going up, it usually is a sign that there is something going on with the heart. If a patient has an EKG that does not show a heart attack and their cardiac enzymes are negative, then the usual next step is to perform some sort of stress testing. A treadmill test is usually how it is done, with the patient walking on a treadmill. The usual protocol on a treadmill test is every 3 minutes, the belt goes faster and steeper until the satisfactory heart rate is reached. On the stress test, the patient's EKG is watched continuously, the blood pressure and heart rate are watched, and the patient's symptoms are observed. At the end of the stress test, the test is interpreted by a cardiologist who can usually determine if there's a problem or not. There are other types of stress tests. You can combine the stress EKG with nuclear imaging or with echocardiographic imaging, and you can also do what's called a chemical stress test. Another common test that is used to evaluate chest pain is an echocardiogram. The echo can reveal a lot of different conditions that can cause chest pain. A chest x-ray can be helpful, as can a CT scan of the heart. One of the tests that we use commonly in the evaluation of chest pain, especially in patients who are over 40 to 50 years old, is a calcium score. This is a test that looks at coronary artery calcification. It's a 5-minute CAT scan. It's usually done at the radiologist. It involves no needles and no contrast. And the number that is derived from that score can tell us a patient's risk. The score is usually somewhere between 0 and several thousand. The lower the number, the better. If the score is over 400, it does indicate that there's an increased risk of a cardiac event in the next 5 years. And for those patients, further testing is probably warranted. If a patient does not pass their stress test, or there are other signs based upon the EKG or the enzymes that they might be having a heart problem, the next test might be a coronary angiogram. This is a test where a doctor threads a little catheter, usually about 2 millimeters in diameter, through the wrist artery, called the radial artery, or through the femoral artery in the upper leg. The catheter is passed to the heart, and angiograms are taken by injecting contrast dye directly into the heart arteries to look for blockage. This is considered the gold standard test for diagnosing coronary artery disease. Patients frequently ask, if we find a blockage, what are we going to do? If the blockage is severe and it is felt to be causing the patient's symptoms, then frequently angioplasty or stenting is performed. Angioplasty refers to the passage of a small balloon to dilate up the artery, usually to make way for a stent. A coronary stent is a metal mesh that is usually shaped in the form of a cylinder. It is mounted on a balloon, and when it is passed into the artery and deployed, it actually pushes the plaque up against the walls of the artery, restoring completely normal blood flow to the heart. Another procedure most people are aware of is bypass surgery. This is a procedure where a surgeon takes an artery from your chest wall or a vein from your leg and literally creates a new blood vessel around the blocked artery. Basically, anybody having chest pain should get an evaluation, at least by their primary care physician. The physician can then refer you on to a cardiologist if necessary. On the other hand, if you're having severe chest pain, shortness of breath, sweating, nausea, you should go to the emergency room for that. You should never drive yourself to the emergency room with chest pain. You should call 911 and have the ambulance take you. The reason it is important to get evaluated quickly if you're having chest pain is that if you are actually having a heart attack, that means part of your heart muscle is dying. Every minute that goes by, more heart muscle cells are dying and will not come back. So time truly is muscle, and it's super important to get to the hospital right away.